act on clotting factors in the blood. They are mainly used to prevent and treat clots formed in the veins, such as deep vein thrombosis and pulmonary embolism. NCLEX-TP, venous clots require anticoagulants. Common drugs include heparin, warfarin, enoxaparin, and dalteparin. In simple exam terms, antiplatelets target arterial clots, while anticoagulants target venous clots. This comparison is frequently tested in NCLEX questions. For nurses and nursing students, careful monitoring is crucial. Always assess bleeding risk, review lab values such as INR for warfarin, and prioritize patient safety. These are key points in both clinical practice and exam scenarios. For NCLEX success, revise drug classes, indications, and nursing responsibilities, and practice questions using reliable study links and evidence-based resources. Strong pharmacology knowledge saves lives, especially at the bedside and in the exam hall.